If you're evaluating Luminello alternatives, the trap is switching to another outpatient psychiatry tool that breaks the day you add residential, IOP, or PHP care. Luminello appears built for solo clinicians and small mental health practices, not facility-based programs that span multiple levels of care. Luminello versus Behave Health, how the two platforms compare across admissions, clinical documentation, billing, and operations. We walk through who each platform serves, then compare them across the workflows a growing behavioral health organization actually runs on. Based on publicly available information, Luminello appears to target solo psychiatrists and small mental health practices with medication management and psychotherapy workflows. Its clinical workflows appear tailored to outpatient psychiatry for individual practitioners and small practices. Behave Health is an all-in-one platform combining CRM, EHR, RCM, and ERP, built for facility-based behavioral health and addiction treatment. Choosing the wrong EHR means months of migration, staff retraining, and potential revenue disruption, and a tool that can't follow you into residential or IOP care. Getting the platform decision wrong means months of migration, staff retraining, and potential revenue disruption, according to the comparison. If facility billing, ASAM assessments, and 42 CFR Part 2 controls aren't a focus, growth into IOP or residential care forces a second platform. Behave Health is designed to support residential, IOP, PHP, detox, and recovery housing in one system, without a second platform for facility-based programs. ASAM criteria assessments and COWS and CWA withdrawal scoring are built into the documentation flow rather than treated as add-ons. A patient record created at the admissions inquiry flows directly into clinical documentation and billing without duplicate data entry. 4 areas separate an outpatient psychiatry tool from an all-in-one platform built for facilities. Let us walk through each. Admissions, clinical documentation, billing, and operations, the 4 areas where the platforms diverge most. Area 1, the admissions CRM that drives census and revenue. A dedicated admissions CRM with lead tracking, referral analytics, and online patient applications does not appear to be a primary emphasis of Luminello. Behave Health CRM is designed to support online applications, instant benefit verification, lead and referral tracking, census, and alumni follow-up. Area 2, the depth of clinical tooling for SUD and behavioral health. Luminello appears to offer outpatient psychiatry workflows, psychotherapy notes, medication management, and e-prescribing for solo clinicians and small practices. Behave Health adds ASAM assessments, COWS and CIWA scoring, group therapy notes with attendance, and a full medication pass workflow. Area 3, whether billing supports the facility forms IOP, PHP, and residential programs rely on. Luminello appears oriented toward outpatient psychiatry billing. UB04 facility claims and utilization review do not appear to be a primary focus. Behave Health's RCM is designed to support eligibility, claims for both CMS 1500 and UB04, ERA and EOB processing, and denial management. Area 4, the operational tools most EHRs leave out entirely. Running a facility means tracking properties, vehicles, maintenance, and staff credentials, tools most EHRs, including Luminello, do not appear to include. Behave Health includes an ERP layer designed for property management, vehicle tracking, maintenance scheduling, and staff credentialing. Already on Luminello and outgrowing it, the comparison describes a structured migration path designed to protect operations and revenue. Behave Health's team handles data migration so records move without manual re-entry across systems. Staff training is part of the path, so the team is ready before the new platform goes live. Parallel go-live support is designed so the transition does not disrupt operations or the revenue cycle. The comparison lists the common reasons organizations look beyond an outpatient psychiatry EHR. Common drivers include expanding from outpatient psychiatry into residential or addiction treatment, and meeting 42 CFR Part 2 controls for SUD records. Others want UB04 facility claims, group therapy documentation, a dedicated admissions CRM, and operational tools in the same platform as the EHR. Behave Health is designed to put admissions, clinical documentation, billing, and operations in one system as your care model grows. CRM, EHR, RCM, and ERP live in one platform, which is designed to minimize the disconnected systems facility programs otherwise stitched together. The platform is built for facility-based behavioral health and addiction treatment, including IOP, PHP, residential, detox, and recovery residences. It includes HIPAA-compliant audit trails and features designed to support Customer 42 CFR Part 2 compliance programs. Stop outgrowing a psychiatry-only EHR as your programs expand. Book a 20-minute demo of the all-in-one platform at behavehealth.com. See how admissions, clinical, billing, and operations fit one platform built for facilities at behavehealth.com.